Hello, this is Dr. Chirag Kotecha at Refined Skin and Body Clinic. This week was question and answer session. I've got a few questions here which some of my clients have been asking me, so I thought I'd share with you. The first one, what is the simplest skincare routine for daily use? You should be washing your face with a cleanser. A mild cleanser will do. Please avoid using soap because that will lead to wrinkles and dryness of the skin. After the cleanser, you should be on a moisturizer, Vaseline, anything that will moisturize your skin that works for you. And then don't forget the sunscreen. So in the morning, it's a 3-step routine: cleanse, moisturize, and apply a sunscreen. At night, again, take off your makeup if you're wearing it, cleanse your skin, and apply a moisturizer. If you've got any skin issues, you want to act on anything, you can add vitamin C in the morning to help protect against the sun as an antioxidant. You can use retinol for anti-aging benefits. People use niacinamide for pigmentation. These are all active ingredients. However, for that, I advise you to see the doctor, take you through the proper steps. Second question, what is the correct order to apply your skincare products? Now, skincare products should be applied from the thinnest to the thickest. So cleansing, like we said first. Then if you have a toner, not necessarily to be used every day, but you can apply a skin toner, followed by your serums. Now, vitamin C in the morning, retinol at night. You've got glycolic acids, hyaluronic acids, different serums. That should be the third step. After that, you can apply your eye moisturizer if you need, or an eye serum, followed by your moisturizer and then sunscreen, especially in the morning. How do I know that my skincare routine needs to be changed? Persistent dryness. You started a skincare routine. Some of these have active ingredients. Yes, it will irritate your skin in the beginning. However, if it's persistent, lasts for more than 4 to 6 weeks, the breakouts keep getting worse over the next 6 weeks, it is time to change. If you've got dull complexion, if the skin becomes excessively oily, sometimes some products do make the skin very oily, they clog the pores, please discontinue that. Now, if you feel a product is no longer achieving its benefits, it might be time to change or tweak them. I've seen clients using products the wrong way, sometimes using retinol twice a day, using brightening products when they should not be, and also avoiding the sunscreen. Number 4, this is a very important one. Skincare myths or trends to avoid. I see people coming in and say, I use natural scrubs, I make my chemical peel or peel from lemon or curd. This stuff can burn your skin. It can highly irritate. Baking soda should not be used on the face, it can be too strong. If you're using scrubs, such as sugar or coffee scrubs at home, this can cause micro tears in the skin and can actually make the problem worse. Some people say, I'm going to start some products for 2 or 3 months, then stop it and then resume it later. This is cycling of products. This is very, very wrong, especially if you've got acne. Once your acne clears up, I see time and again, people will stop their acne treatment products to try go and brighten the skin and the acne break out. Please do that under strict guidance or speaking to your specialist. People say, I'll drink lots of water. 2 to 3 liters of water is good a day. Some myths come that if you drink up to 5 liters, it will help clear up your acne. That is not the case. Acne is a medical condition, thus requires treatment with good skincare products, antibiotics if needed. We've got people using things they see on TikTok, on Instagram, where they start using micro-needling devices at home in not the proper way. So do not see a trend there and start doing that yourself. And this is something I see a lot quite often. Patients come and say that, but doctor, I don't leave the house. I've been at home all day. It's raining right now. I don't need sunscreen. There are multiple types of UV rays. There's ultraviolet A, ultraviolet B. Some of it does go through the glass pane. Unless you sit in an enclosed room without any exposure to the natural sunlight, that means no windows at all. Even if you're at home, you should still be applying sunscreen. Do not make that mistake of avoiding sunscreen. So when should you come see one of us, a doctor, a dermatologist, a skincare specialist? This is when you should go. We get people, teenagers with acne, but once that acne starts leaving you scars and marks, it is time to see the doctor, because those scars and marks can be with you lifelong, are more stubborn to treat, very difficult. If you've got a rash that is coming on the body that is spreading very fast, is painful, to come and see us. Darkening pigmentation. I see this a lot with our clients. Pigmentation on the cheeks. Now, a lot of the time they've not used sunscreen, they're developing melasma because they've had multiple children, chronic sun exposure for the ladies. You've not been using proper skincare routine, using the wrong products at the wrong time. Please see the specialist. Very important, skin cancer, any growth on the body that is rapidly growing. Remember the A, B, C, D. A, asymmetry, any lesion that is changing shape, the border is becoming irregular, the color is changing, rapidly growing. please see the doctor. We need to treat that. We need to biopsy it. We need to make sure it is not something that could be detrimental. Eczema, psoriasis, these are chronic conditions. Patients who have got this know that it's been there for long. They know how to manage it with their lifestyle, moisturizers, avoiding chlorine, avoiding soap. If it's spreading rapidly, come see us. You might need interventions with steroids or some medication that has to be taken orally. Something we see often here, again, reaction to new skincare. You introduce a new skincare product, especially with active ingredients, retinol, glycolic acid, etc. It can react with the skin initially, but if it's persistent over 4 to 6 weeks, please do come and see us. And obviously skin infections, you know this, you've been stung by something, you've got a boil, severe dandruff, these are infections that do require medical attention. Number 6, compared to what we said before, risks of relying on trending skincare hacks. If you use those lemon chemical peels, curd, vinegar, home acids, they can lead to chemical burns. Hyperpigmentation. Now, if you use something that your friend is using, something that you find online, it can lead to pigmentation, especially in our type of skincare patients here, the darker skin types. You could be wasting your money. I've had clients coming in, I'm sure you might have an experience of that. Go to the pharmacy, try to treat the skin with multiple different conditions, different skincare products. They come to see me, they come with a big bag full of skincare products, and I'm telling them, dump half of this, throw half of this. They're using 2 or 3 of the same kind of active ingredients because they've picked it up from duty-free when they travel, from the pharmacy. This is wrong. A lot of patients in East Africa rely on this lightening skincare products, which are mixed downtown. They've got hydroquinone, which is a bleaching agent, steroid in there. Now they become steroid reliant. They get these steroid acne. They think these fast-acting creams that help brighten the skin are working better, but these are ineffective. They damage the skin. Again, what kind of ingredients to avoid? These harsh physical scrubs. People say I've used essential oils. Coconut oil. Coconut oil on the face can lead to acne. It clogs the pores. It is what we call as highly comedogenic. It leads to acne, making it even worse. The hydroxy acids, the glycolic acid and salicylic acid you might find in the pharmacy, there's different concentrations. Some might be suitable to your skin, some might be too powerful. They're not right. Retinol at night. Sometimes these can be too strong, and if you don't use a moisturizer after it, you will have peeling of the skin around the mouth, around the eyes. We've talked about hydroquinone and steroids. These are unregulated, not to be used without proper medical guidance. Please see a doctor or a dermatologist. We can prescribe you hydroquinone or steroids, but for specific conditions without damaging your skin for a certain duration of time. Sunscreen, make sure it looks at non-comedogenic sunscreen that can help you. Question number 8, difference between cosmetic and medical grade. Some doctors will say there is no difference. However, I care to disagree. Cosmetic products, which you can buy over the counter, the supermarket, these can improve the appearance generally a little bit. They have low concentration of active ingredients that we, as doctors, we want something stronger. They're easily available over the counter, and the results take a mild, and they take a bit longer. Medical grade products, what we can prescribe, they have higher concentration of proven ingredients, salicylic acids, tretinoin or retinol, tretinoin especially, which is medical. They deliver the clinical background. They've been studied. They've got what we call randomized controlled trials. We've tried it on the patients. We've done placebos where we try products without any active ingredients versus products with active ingredients in proper control settings, and we can see the difference it makes. They are formulated on scientific backup, not trends that you see on social media. One of my favorite topics. Doctor, I've come in. What can I do for my lifestyle, which will have the biggest impact on my skin health? Drink lots of water. Sleep well. Consistent sunscreen use. Manage your stress, please. Exercise regularly. Avoid smoking. Excessive alcohol intake. Changing your pillowcases regularly. Makeup brushes should be disposed, regularly changed. Dangers of using expired or fake skincare products. Now, this can vary. Some countries in the world insist on applying expiration dates on their skincare products, shelf lives. However, with new technology, you get something called airless pumps, where there's no air. So the products can last indefinitely, up till 2 years after they've been opened, exposed to air or oxygen, oxidation. But sometimes if it's very, very long overdue expired, it can lead to allergic reactions, severe irritation, can make acne worse, can lead to breakouts and cystic acne. And some older products used to have things like mercury or strong steroids in them. Those should be avoided. There are skincare products that I've brought into the country or used at my clinic, and then a client comes in and has bought something similar or the claim to be the same, but these are fake and they lead to problems, leads to reputational damage. So please be careful where you do buy your skincare products from. Make sure they're an authorized or an approved distributor or a reputable clinic or pharmacy. Effects of skin lightening creams. I see it often. I get clients coming in that, doctor, my skin is damaged because of the skin lightening. You get uneven, what I like calling the zebra crossing skin, black and white sort of pigmentation. The skin is very thin. You can see the veins on the face or on the body. They've got really bad stretch marks. Now, this is sometimes it's so permanent that it's very impossible or difficult to treat. Don't think that one skincare product your friend is using is going to work for you, especially these ones that are mixed downtown. They often have mercury, which can lead to kidney damage in the long run, hydroquinone, which is a bleaching agent, and usually with steroids. These are not safe. We've got alternatives, especially with glutathione, that is very popular now, whether it's tablets, creams, or as IVs, you can opt for that. The first thing I will tell you when you come in, stop those lightening creams. The patient will tell me, but I'll go back to my normal color. I'll look dark again. My friends will not recognize me. If you want me to treat you or a doctor to treat your skin issues, especially when you're on lightening medication or lightening creams, first thing is to stop those products. Before coming to see us for your skin color, ask yourself, have I listened to this video? Have I stopped those lightening skincare products? Is there a label on these products? Do I know what I'm using, what I'm putting on my body? Stop those first, because that is what we will do for you. So thank you. These are the question and answers we've had this week. Follow us on our social media handle, on Instagram, on TikTok, X, Snapchat, website at refinedskinandbody.com. Do visit us. If you have any questions, do shoot them in, and we shall endeavor to answer them to our best capability. Thank you, and see you next time.